Lubna, no? Okay, come.
Good afternoon, everyone. I'm Dr. Lubna. So my title is Sweet Galaxy Eyes. It is based on asteroid hyalosis, which is a common degenerative condition of the vitreous gel. It is benign in nature. So it has a characteristic appearance of stars or asteroids in the night sky, and it was first described by Alfred Hugh Benson in 1894. Hence, it's also called as the Benson's disease. It is an asymptomatic condition, and the pathogenesis is not clear. We see calcium pyrophosphate crystals which are collected within the vitreous. The aim of my study was to study the relationship between asteroid hyalosis and diabetes mellitus. It is a cross-sectional study which was done over a period of 6 months. Patients who were diagnosed with asteroid hyalosis were selected, and my exclusion criteria was patients with hypertension or other systemic conditions, previous history of retinal or vitreous disorders, or mental retardation. About 60 patients diagnosed with asteroid hyalosis were selected. They were divided into two groups, Group A and Group B. Group A had patients with diabetes and Group B without diabetes. Ethical committee clearance and informed consent from patients were taken. Detailed history of all patients was taken. The ophthalmic examination included visual acuity testing, anterior segment examination using slit lamp, posterior segment examination using IDO, and the random blood sugar of the patients were recorded. Results. So in Group A, we had around 42 patients who were diabetic. Group B had 18 patients who were non-diabetic. So in Group A, around 64.2% were males, while 41.35% of them were females, whereas in Group B, around 10 males and 8 females. Eye involvement, it was noted that the bilateral involvement was more than the unilateral one. In Group A, we had 42.85% unilateral eyes involved, whereas in Group B, we had 44.44%. The p-value was found to be less than 0.001, which was extremely statistically significant. So here in our study, we have so the causes and mechanisms of asteroid hyalosis remain unknown. In our study, we noted that it was mostly seen in males. The condition was mostly seen in males. It was mostly a bilateral condition, and most of the patients that we had noted were diabetic.
इनको क्वेश्चन नहीं पूछेंगे, जो they will just press.
In previous studies, we've seen Zinn, who reported 27% patients with asteroid hyalosis were diabetic, and Berggren noted around 29% patients who had asteroid hyalosis. So my conclusion is there's a significant association between asteroid hyalosis and diabetes mellitus. People who are observed to have asteroid hyalosis as an incidental finding should be screened for diabetes mellitus. Nil financial disclosures. These are my references. Thank you.
Thank you.